All right, as more people trickle in, welcome everyone. Thank you for joining us. And before we get into the big introduction, I'm going to hand it off to Javi with Rooted Language Justice to go over the live interpretation access and how to use all those features. So, Javi.
Gracias, Leo. Thank you so much, Leo. So good afternoon, everyone. My name is Javi. I will be one of your interpreters during this meeting. I'm going to do this brief orientation on how to connect to language channels in English and in Spanish. Hola, muy buenas tardes. Gracias, Leo. Mi nombre es Javi. Voy a ser una de las intérpretes esta tarde durante esta reunión. Y vamos a hacer este mensaje en inglés y en español. Así es que voy a iniciar para que nos conectemos todos a los canales de idiomas. La justicia del lenguaje es una práctica consciente durante estas reuniones donde el inglés y el español se hablan activamente. Language justice is an intentional practice during these meetings where both English and Spanish are being actively spoken. La función de interpretación ya está activada. Si están en una computadora, verán un globo terráqueo en la parte inferior de la ventana de Zoom. Si están en un teléfono móvil, van a ver tres puntitos que dice More o Más. Van a hacer clic ahí, elegir interpretación y seleccionar el idioma que hablan. Les recuerdo que si no son completamente bilingües en inglés y en español, deben de escoger un canal de idioma. The interpretation feature is now activated. If you're on a computer, you will see a globe at the bottom of your Zoom window. If you're connected from a mobile device, you may see the globe by accessing the three-dot menu that says More or Más. Click on these and select Interpretation, and then select the language you speak. A kind reminder that if you're not fully fluent in English and in Spanish, you must select a language channel. Si tienes unos audífonos con micrófonos disponibles, por favor, úsalos. Se nos hace posible la interpretación si te podemos escuchar claramente. If you have a headset with microphones, please wear it. It makes interpreting possible if we can hear you clearly. Ahora vamos a hacer una prueba de canales. Is that me? Sorry.
Katrina, can you mute your line? We're getting echo.
Sure, sorry.
No problem.
Thank you. Ahora vamos a hacer una breve prueba de canales para verificar que todos están conectados. Now we're going to do a quick language channel check to make sure that everyone is connected. I'm going to speak only in Spanish. Muy bien. Entonces, si están
Very well. So if you're on the English channel, you should be able to hear my colleague interpreting into English. Give me a thumbs up to confirm that you are connected to your channel. Perfect. Thank you, Claire. Well, and so up next, I'm going to share a few reminders for this meeting. These are guidelines to support language justice. We ask everyone to speak at a moderate pace, especially because this presentation will include a lot of data. If we need you to slow down, we'll share these little turtles in the chat. If you mention complex terms or abbreviations, we ask you to please spell them out or explain them. 1 second pauses between your sentences allow us to interpret the entire message being shared. So we invite you to speak at a moderate pace and take breaths between slides. We also remind you that we use language inclusive language, especially in Spanish. So we invite you to join us in this practice of inclusivity. Thank you. We will now pass it over to the host. And if you need any support, please let us know in the chat. We may now begin with this session. Thank you.
Thank you, Javi. Muchas gracias, Javi. I forgot to introduce myself. My name is Leon Tiveros. I am the Health Equity Program Manager, 2.5 weeks running now. So excited to see everyone here, and thank you all. I'm super glad to see the turnout. I'm glad that you're joining us today to hear about the findings of our very first SLO County Mexican Indigenous Enumeration and Health Assessment. This assessment was funded through our public health department to better understand and serve our Mixteco-speaking community members in SLO County. It was initially focused on equitable access to COVID-19 vaccines and resources to farm workers, And we began to discover a growing population of Mixteco-speaking farm workers facing systemic language and cultural barriers that make it challenging to access health services and their basic needs, address their basic needs. Mixteco, with its 81 variants, is often misclassified as Spanish, hindering access to services. Attaining demographic and health data on the Mexican Indigenous people in SLO County was important so that we understand, so that we, the Public Health Department, and partnering organizations can better fulfill our missions and provide culturally relevant and linguistically appropriate services to Indigenous communities in SLO County. From census data, we know that the Latinx population comprises about 23% of SLO County, but there is no disaggregated data on what percentage of this is Mexican Indigenous population. So there are challenges to accurately counting this population, as many are undocumented, so they tend to be hesitant to trust outsiders. With that, we are super grateful, especially grateful of our trilingual team that conducted this assessment, as it would not have been possible without them. The dream team, as we call them around here, was comprised of MICOP, which is the Mixteco Indigenous Community Organizing Project, represented today by Silvano Vasquez, Cuesta College, Derringer and Associates, with Joel Derringer here, and California State University San Marcos with Bonnie Bade. So I'd like to introduce them, and they'll be doing the rest of the presentation on the assessment, and there will be an opportunity for Q&A after, Joel, if you prefer after, so we can have an opportunity. And in the chat, if you can just drop your name and which organization, or actually we're all Public Health or SLO Health Council, never mind. But maybe what division you're with, which program that you're with, that'll help us, guide. So I'll hand it off to Joel.
Great, thanks so much, Leo. Let me sure I can share here. Put it in slideshow mode. You guys see that? So we're seeing the slides now? Yes. Joyce? Yeah, you're my, okay, thank you. All right. Thank you, Leo, and welcome everyone. This is a good crowd. I've worked with many of you, and I suspect a few of you have already seen some version of this presentation. As Leo said, this is the first it's the first survey and funded by the Public Health Department of the demographics and health issues among the Mexican Indigenous community in San Luis Obispo County. We've already covered part of the team. Presenting today will be myself, Silvano Vasquez from MECOP, Bonnie Bade from Cal State San Marcos, and unfortunately not able to join us were our lead data and co-principal investigator, Mario Espinoza-Kulik and Alex Espinoza-Kulik. Also received funding that I want to acknowledge from First Five, as well as from the Board of Supervisors and several other funding sources. The board was very helpful in getting us moving and arranging or providing some funding for the initial gift cards and that we had given participants. So I'm going to go over, we're going to cover a lot of information. We will make the slides available, and let's hold off questions until the end. So we're asked to talk a little bit more about the methods that we used to undertake the survey. So one is, Leo said, we worked with the Mixteco Indigenous Community Organizing Project, which has done prior research, not in San Luis Obispo, but certainly in Ventura and Santa Barbara counties. Our trilingual staff, led by Silvano and several other MECOP staff, interviewed 325 Mexican Indigenous residents in both the North County and the South County. These took place between April and August. So this is during the growing season, which may have influenced some of the findings or availability even, because it's the working season. We met with our team weekly to review progress and make adjustments to capture the diversity of our interviewees, both geographically, tried to get a gender balance, and make sure that we were getting a somewhat representative sample of those that we were talking to. We used what's called a snowball methodology, whereas we started with known people at MECOP and used them. We talked to the indigenous workers and asked them for referrals to others willing to participate. This is great because, you know, there are some contacts within the community and word spread. On the other hand, there's some limitations to it. So if you ask a farm worker to refer another farm worker or another farm worker, we're not necessarily going to pick up people in other industries or necessarily in other areas. As we've said, it was really the trust that was built up between MECOP and staff and the indigenous community that led to the success of the survey. And we released the preliminary findings at a large event at Cuesta College in Paso. That was a trilingual event that I think a number of you attended. And we got a lot of feedback from the community, which is incorporated into what we're talking about today. So I think, Silvano, you're up here for the next few slides.
Muchas gracias, Joe. Yo les voy a platicar un poco sobre el
Thank you,
origen.
Joel. So I'm going to talk to you a little bit about the origin and language. As I mentioned, I'm Silvano, and I was the coordinator of the team that interviewed individuals. I coordinated how many gift cards would be dispersed each week, how many surveys would be done each week. And so that was under my responsibility while Mario's team gathered and collected this data. And I don't remember the name of the data system, but I'm going to talk to you a little bit more about the language and origin of this community. So first of all, I do want to mention that Mixtec is an ancient language with no linguistic relation to Spanish. So this is the third most spoken indigenous language in Mexico. And we have approximately 500,000 speakers. And there are approximately 196,000 speakers in the southern western region of Mexico, primarily located in the state of Oaxaca and Guerrero. And in this region in general, we see a lot of indigenous languages, many that are still spoken and many that have disappeared for a variety of reasons and factors. And this is a tonal language. So there are some folks who are still able to write the language, but people like myself who grew up in our villages and went to school, I'm not sure why, but at least when I went to school, I was no longer able to receive instruction in Mixtec. So I didn't learn how to write it, but I learned how to speak it. And the majority of people in this county, of these people in our county, live in Paso Robles, Shelton, and San Miguel, as they follow agricultural patterns. And as I mentioned, most folks are originally from Guerrero and Oaxaca, and you can see the percentages in the slide in front of you. And these are folks that are coming from over 100 different hometowns. And so what we heard through the survey is that most of these folks still speak their language at home, which I was really happy to hear that they're really preserving their language. We also learned from the surveys that most folks have arrived in the past 4 years during pandemic years. So that lets us know that in some way or another, we're not quite sure, but our mixed community was affected by the pandemic because they really also, there was a surge in migration from that point on. I'd also like to show you where the sending communities are located, both in the state of Oaxaca and Guerrero. So we can see the municipalities and villages located here. So next, Joel. And here we have the different hometowns that folks are coming from that we interviewed. So besides the name of each hometown, we have the number of people that we interviewed. So obviously we didn't interview everyone from one hometown because we wanted to receive input from a wide range of regions and sending communities. But the majority of interviewees were from Mletatonok and Chapoa Grande. And so we're going to go on next. And then these are the hometowns in Oaxaca. So again, these are different states. And people, the interviewees are originally from the hometowns that are listed here. Next. So I'd like to share that the mixed community that resides here is predominantly young, with an average age of 29 years old. The majority reported having limited access to education. 21% mentioned that they obtained no formal education, and so did not have any access to any formal degree. 44% reported that they attended some part of grade school. 25% attended middle or junior high school, and then 10% were able to attend the equivalent of high school here in the US. And the majority reported that they work in the fields, and a small minority worked, or 82% reported they work picking grapes, and others also reported working 2 jobs. Many folks really preferred to be able to work in the agricultural industry and also work in the service industry like a restaurant, because they often don't have secure employment in agriculture. So they need to have 2 jobs to make ends meet. Next slide, please. So as far as income, families reported that their income is below $2,500 per month. So this was 80% of families reporting this. And people also reported that 14% earns between 2,500 and 3,000 per month. And this is through their work, and due to the fact that they have very unstable or infrequent work, depending on the weather or shifts and changes in agricultural. So that was the case last year, or even recently. Folks have gone maybe a month without working, right? So we couldn't indicate an exact amount as far as incomes, because that's can fluctuate. But in SLO County, the cost of living for a family according to Dr. Mario Espinosa's research, cost of living for a family of four is $8,183 a month. So this is quite a lot. It's pretty expensive to live in this county. And so most folks are only able to cover their basic expenses, insurance, and, automobile costs, and, cover personal or family needs. Next.
Now I'm going to talk a little bit about households. 63% of the partners and spouse, they do live together. They're either married or together. And then a large amount of them live with children, and 87% does live with children under 5. And they also mentioned that they have up to 14 people living in one household. And there are times that other people, that about 11 people live in one bedroom. And we saw this situation pretty often during this survey. Most of the people sharing this, that they had housing access barriers, because most of them don't have a good credit history. They don't have a credit history because a lot of them were not born here in this county or in the US. So with the requirements that people ask to rent a studio or an apartment or a place to live, it becomes very difficult, and they're just become ineligible to live comfortably. While very few of the people they know that have all of these requirements in order to access housing, they rent under other people's leases. So it is a pretty alarming situation that so many people have to live in one place together, because it could be that one person may get sick and can get others sick. I can only imagine how they were handling the situation during COVID. And so I think from this point forward, I can hand over the presentation to my other colleagues. Thank you so much for your time.
Hi, everybody. I'm going to speak a little bit about what we found with health. And of course, the most alarming portion is that we found a great majority of people suffering from hunger. And we had 64% of people say that they didn't have enough money to eat in the last year. So this is very alarming, and hopefully this can be something that we can address through collaborations with other organizations. But also I wanted to call your attention to some of the most common health problems that we are finding, which, as you can see, are emotional. Stress and sadness and anger rank very high in terms of what folks were reporting as their most common health problems. And just a word on this, I've been doing some of this work for a very long time with Joel, and this is consistent with the kinds of findings that we've been finding since the mid-90s into the 2000s, 2010s, and into the 20-teens. We've been finding stress and sadness and anger as very prominent problems among Mexican Indigenous communities living in California. So to find this in San Luis Obispo, unfortunately, not too surprising. Also, headaches, and we have more on the list, but headaches are also very indicative of numerous other kinds of factors that might be affecting people's health, not only the emotional related illness types, but also perhaps pesticide exposure or heat exposure and other kinds of, environmentally related health conditions. And then, of course, dental problems. And as you'll see as we move on, dental problems have always been an issue among farm workers throughout California. And we find this is consistent in San Luis Obispo. How about that next slide, please? Now, as you can read here for yourself, we see then very little use of clinical healthcare services. You know, more than half never having had a physical exam, and you know, nearly 2/3 never having had a dental exam, and then more than three quarters never having had an eye exam. So this is another area where we're hoping that the county can perhaps work with some existing resources there to try to improve those numbers. We also see that in terms of biomedical and clinical healthcare services, community health centers are super important in this community and form one of the primary sources of clinical healthcare. We also, though, see that pharmacies are super important, and this might be consistent with what we see in Mexico in general. People really tend to use pharmacies a lot as a source of healthcare. And then we see 14% going to the hospital. And later on in the slides, when we look at insurance, some of that hospital visitation might make a little bit more sense when people are relying on Medi-Cal for emergency or pregnancy-related care. But I also wanted to call your attention here to the traditional care. 65% of our participants reported visiting curanderos or you know, traditional health practitioners who might use herbs or other forms such as massage to treat various health conditions. And just a note that this is also really consistent. My work in the Central Valley in the mid-90s and the mid-2000s, we also saw high usage of curanderos. And this is more complicated. Some people might like to interpret that as because these are more recently arrived Mexican Indigenous peoples, that they might still be very connected to their traditional healthcare practices. But also, I would like to point out that this has to do also with supplementing the lack of clinical care with the kind of care that they do have available, which would be through their own practitioners.
Bonnie, if I can jump in, the interpreter's asking that you slow down. Although I know for you, you are speaking slowly.
Okay, I'm done with that slide for the moment.
Okay.
All right, and of course, as you probably all know, the lack of health insurance is our primary issue regarding the healthcare of farm workers, Mexican Indigenous farm workers. And if you look at these numbers here in the bullets, you can see that we did have 6% say that they had complete Medi-Cal. But we have here 20% for emergency Medi-Cal and 25% for Medi-Cal for pregnancy-related services. And again, going back to the lack of overall health insurance, pregnancy and emergency-related ailments can be treated at hospitals through Medi-Cal. So those numbers kind of conflate there a bit. Next slide, please. Again, this portion here, the barriers to healthcare have been for the last 30 years throughout the state. Transportation is number one, especially in the agricultural regions where we have families that are living far away from clinics and far away from places where they can access clinical care. We also have, of course, cost as a big barrier, and then again, language, another big barrier. And these findings that you see here are consistent with findings that we find elsewhere. There are other counties, such as San Diego County, addressing those kinds of issues, transportation, by providing transportation from migrant clinics, et cetera, or having sliding scale pay systems at clinics, or hiring trilingual language interpreters, medical interpreters. I think that's you again, Silvano.
Gracias, Joyce.
Thank you.
También quiero recalcar
I also want to highlight
las personas que tienen
the
no tienen aseguranza.
the people that don't have medical insurance. Many people starting this year
Ya pudieron tener
were able to
ayuda,
access full
ya sea
medical
para
because
ingresos. Entonces,
immigration status does not interfere with that. So lots of people were able to access it. So we hope that all these people that we have here, the high numbers that don't access medical, it actually lowers because they are able to access it now. So also, you know, they share their health concerns, and the all of the surveys that we ran through represents about 200 people who self-identify as indigenous. Excessive heat has been a main concern for the folks who work in the in the northern region. Now that summer is coming, warmer weather is coming. Many of these folks are not going to be able to work because of excessive heat, and many people who continue to work, they start to get headaches, they get stressed, and other health issues related to heat. And most of them also, they also mentioned that they were concerned about natural disasters, that they don't know when one would come, a flood would come, or an earthquake. Like this morning I was asleep in my apartment. At 6 a.m., I felt an earthquake, and so I went to my Shake app, and I realized that there was an earthquake in Paso Robles. Um, so it happens, you know, like it's unexpected. So any natural disaster can take place at any moment. Also, it's a really dry area, and we're prone to wildfires. So a majority of them did inform that they were concerned about that, and they mentioned that they were concerned with their health because of their working conditions, like they have a difficult work duties. A lot of women share that it became a heavy workload. They also shared that they mostly feel uninformed regarding how to nourish their bodies better, to have access to various nutritious foods, and to sometimes where they buy their groceries. Many of these folks don't read, and they will grab something. And once they bring it home, they realize that it expired much sooner than they thought it would. We also had people mention their concerns for pesticides at work sites. Sometimes these pesticides are applied um, to kill plagues that invade grapes and the vineyards. So when these pesticides are applied, they started to feel headaches, their stomachs starting to hurt. 38% of them also mentioned that they were concerned for their children's health. Like I had mentioned earlier, some of them also mentioned that they were exposed to smoke when these wildfires take place. Um, Vaccines also, many people, they were concerned regarding vaccines mostly because they don't feel informed whether vaccines are good for you or not. And especially during COVID or any other vaccines that doctors suggest, like these folks just don't know, and so they get concerned regarding vaccine practices. Regarding dental health, we did mention earlier that many folks did mention that they had never had a dental exam. Next. COVID is a really important topic to mention. We saw that 55% of these folks shared that they had only received one dose of the vaccine against COVID, and a lesser percentage had reported having had a COVID test at least once. Among the participants that were vaccinated, the majority received only one dose of the two-shot sequence. Next.
¿Cómo las personas les gustaría
As far
recibir
as how people would like to receive health information or any other resources, the top one would be through WhatsApp. Most folks are very used to using this application because it's widely used in Mexico. It's easier to obtain information through audio, video, text, images, and it's the best way for folks, or the preferred way for folks to receive information. 66% also preferred text messages. Half of folks were open and receptive to flyers. 47% are on social media, such as Facebook, social media in Spanish. And receiving information through social media makes it more accessible because there's many families that are multilingual, right? We even have trilingual families that speak Spanish, English, and Mixtec. So sometimes children are the ones who help their parents navigate social media through which they can obtain information and stay updated on what's going on in the county. Some farm workers also opted for receiving information through radio, and 26%, which is a minority of the population who don't speak or understand any Spanish at all, do prefer announcements in indigenous languages such as Mixtec, Tlapanec, Nahuatl, because we also identified that there are other indigenous languages in this county. So we have a very diverse county, actually. 25% preferred to receive announcements in Spanish. And we did receive a lot of comments from folks who need support in navigating medical access, specifically in the city of Nipomo. Many folks mentioned that they often needed interpreters at CHC centers, but it does seem to be that the organization or the agency at Herencia Indígena is doing a great job at also providing these services, interpretation services at clinics. Next up. Okay, I almost skipped the slide. Okay, so I'd also like to share a bit more about water. The majority of folks mentioned that they do have running water at home, but the majority of folks, or many folks, reported problems with their water, including bad smell, bad taste, and an ugly color. And this was a frequent problem. We kept on hearing it from a lot of different folks. The water isn't good. It smells like bleach. The taste is bitter. The color is a little bit cloudy. It's not clean. So these are reports that we received from folks who participated in the survey. And 73% depend on bottled water daily. Given that many are farm workers, they have to carry their water. And according to Dr. Mario's research, one person depends on at least like 1 gallon of water per day. So the community is purchasing more than 1.7 million gallons of water each year. And something else that is concerning is that folks are buying a lot of bottled water and an increased increased use of plastics, right? So I also want to highlight that further research is needed on this topic. So I'm going to turn it back to Joel.
Thank you. Did we? No, we didn't skip a slide. Okay. So along with our community input in Paso in October, we also had a community advisory committee to whom we presented the preliminary findings, and this is how we've drawn out recommendations. So the first one has to do with health access. So these won't come as any surprise for anyone, but it's reducing the financial barriers, the language barriers, and the cultural barriers to healthcare. So financial, we do have a new Medi-Cal eligibility. The state or the county has already rolled over everyone who was on limited scope Medi-Cal. Those who had pregnancy-related Medi-Cal or emergency Medi-Cal now have full scope Medi-Cal through CenCal. There's also probably quite a number who were not on these restricted scope programs who need to now apply and are eligible for. As Silvano also talked about, having medical interpreters who are familiar with the variants of Mixtec that are coming through the facilities and can help both in Spanish and back to English interpretation, since a lot of the providers are not proficient in Spanish either. The transportation barriers, we've heard quite a few. That was one of the two highest barriers to accessing care. So we have mobile clinics in the county now that are up and coming. So we want to make sure that they're available to the Mixtec speaking population. Also have vans or pickup sites for transportation to clinics. And then another one to reduce, rather than so there's two ways. You either bring people to the clinic or you have the clinic come to them. And that would be through a mobile clinic or perhaps a health fair. Health capacity is both related to providers who understand both culturally and linguistically the patients and clients that they see, but it's also having services available after work on weekends. It's very hard for a farm worker to say, oh, I'll make an appointment and it'll be, during working time. It's also a large lag time in being, just the process of making an appointment is very difficult. The food access, we saw 62% said that they did not have enough money to buy food for them and their family during the year. These are farm workers. They're working in the ag industry and they're working full time or as much as they're able to, yet they can't afford food. So we've already had discussions with the food bank about making their resources more available to the Mixtec community and having the Mixtec community more comfortable in actually accessing those resources. So there are many things that we already have in the county. They're just not reaching this population. There's larger community support that we can provide. One is having community services for immigrants. There's an effort funded to develop a plan for an immigrant resource center that SLO County on DocuSupport support is spearheading with some public health funding and seeing what are the opportunities for creating a site or a virtual site to provide services directed for the immigrant population. In housing, we've heard about severe overcrowding in the housing. I think the average was 7 people are in 2 rooms. Yet I think it was either one or none in the survey of 325 people said that they were what we would call traditionally homeless. They're all doubled up, tripled up, quadrupled up, but they don't fall into the category of homelessness. So we've been talking a lot more about bringing overcrowding into the policies, discussions, and grant funding related to homelessness. And then, as Silvano showed in the slide, there's some issue with the water. People don't like it. They're not drinking it. They're buying bottled water. Why? We're not sure yet. Whether it's cultural, whether it's actually there's something wrong with the water, these all need a lot more understanding about what the barriers are with the drinking water. And, we hope we're beginning to pursue that. And then it's sort of the new directions for how we process or how we supply services is improving health communications and education on the phone in Mixteco. Now, nearly everyone had a cell phone. Very few actually had internet service other than through their cell phone. But as you saw in the slide from Silvano, they prefer communications in Mixteco, whether it's through WhatsApp or texting. Young children and families, this is a very young population. So the majority have children, and most of those have children under 5. So we've already had some discussion. We did a presentation to the First 5 Commission a few weeks ago to really make them aware. And it's not only young children, but it's parents and pregnant women and breastfeeding women need a lot more work. And this is a population that has a lot of children. Educational opportunity, very few have had, I think it was over half have maybe had a grade school education. So there are ways working with the local school districts and providing some more education for parents, whether it's could be bilingual education or learning English as a second language. And I think there's also opportunities for Cuesta College, which is has a large campus where the majority of our interviewees lived, and providing more professional opportunities as people move up the ladder in terms of jobs. Climate resilience, you heard some of the top concerns had to do with heat and natural disasters. Flooding puts people out of work. Heat puts people out of work and makes them sick. So we really need to understand and do more about climate resilience, particularly for populations that already have cultural barriers, language barriers, and in accessing any services. The COVID response, we're not over with COVID, and we're not over probably with new disaster, public health disasters to come. So I know Demetrio spent a lot of time, walking the streets up in the North County and trying to reach out with COVID education and services. But we see that, very few relatively actually either had testing or received 2 doses of, the 2-dose vaccine. And then, as I know, the county is going through a lot of strategic planning at this point. We've invited the SLO Health Counts and Community Health Improvement Project committee members to this session. So part of that is incorporating the needs of, what's a relatively new but very high need population into that strategic planning into the future. So let me just talk briefly about what our next steps are. One is disseminating the report widely in these slides to service providers, policymakers, and community members, just waiting for the final sign off from the Public Health Department, and we can release the report. We're already working with providers to provide and enhance really the cultural and linguistically competent services, whether it's with the food banks or, as Silvano was saying, with community health centers and providing trilingual or Mixtec interpretation services. We know they're Herencia Indígena is now providing services to the county programs as well as to the hospitals. So we've, since the survey, we've actually made big strides. And then lastly, we'll be launching a webpage, which will have the report. We're gonna have public access to the actual data. We'll making a recording of this presentation, all of which will be available in the coming weeks or months. So now we're up to hearing from you. I'll stop the screen sharing so I can actually see you all. And well, first let me ask if Silvano and Bonnie have anything to add, and then we'll open it up for questions and discussion.
I did want to add that I wanted to point out that all of the images that you saw on the slides, the drawing images, those all come from a pre-colonial text known as the Codex Natal. It is a Mixtec text. There were millions, they were burned, but 8 Mixtec texts have survived, and that's one of them. So you're seeing things like the curandero making an offering to the river, or you're seeing different flowers or different kinds of images. Those are all pre-colonial images written in the Mixtec written books, pre-colonial books.
Thanks, Bonnie. And thanks for, drawing on your understanding of all this and getting them in the slides. Silvano, anything you'd like to add?
Sí, claro.
Yes, of course. I would like to share with you all something that Dr. Mario Espinosa shared with me. Since the majority of people prefer to receive information via WhatsApp, he shared with me that that is how it can be done. First step is to create a WhatsApp as a business connected to Facebook. This allows you to utilize different specific functions for businesses. And then the second step would be to gather a contact list and maybe organize them by needs and make your organization available virtually through a QR code, our website. It is useful to use text, audio, or images to share with these folks. Emojis and GIFs can make it so that the messages can show more emotion or expression, and they actually get more attention. Messages, fourth step would be that messages will be sent via WhatsApp broadcast or automated workflows to avoid spam. And finally, you assess how you make announcements utilizing WhatsApp and make it fit into whatever works better for you. This is some of the information that Dr. Mario shared to be able to share information successfully for those folks who do not speak Spanish or English. And that's all. Thank you.
Great, thanks, Silvano. And along the lines of language accessibility, I mentioned we're going to have a web page. It will be bilingual in Spanish and in English, but we're also going to have sort of pop-up bubbles with voiceover. So it'll start reading it in Mixtec if you click on the bubble. So I'm excited to see that actually in action. So let me now open it up to questions and comments. And let me see, I don't know that I can actually see everyone. No, they're still on 2 screens. So just raise hands and we'll try. And Joyce, maybe you can help me with this. Or feel free to unmute yourself and pop in.
I have a question.
And if you can, okay, it's Leo. So just introduce yourself, because
Leo.
There's a lot of pictures here, so I'm not sure who's speaking.
Leo, with Health Equity. The slide I mentioned, the majority arrived the last 4 years. Is that to our local area, so to Paso, or is it to the states? that they arrived within the last 4 years to the country.
I believe the question was when you came to San Luis Obispo. Is that right, Bonnie?
Yes, it'd be interesting to find out if that is the case across the state, but we only have data for San Luis Obispo.
Well, yeah, and I think the question is, did they move from somewhere else in California to here? So I don't think we asked that, but we'll check. Oh, Vaughn, I see you have a hand up.
Good afternoon. Hi, Joel. Thank you for the presentation. I learned a lot and just really appreciate the insights into the Mixteco community in SLO. My question is, given that we have about roughly 2,300 new members in SLO, we have demographics such as age and zip codes and gender. But I wonder, we would like to really be on point with our outreach messaging and assist the new members in navigating the full scope Medi-Cal services that they now have access to, and wonder if there are tips, hints, or strategies that you think we need to be aware of. We are working with MECOP, but would love to also expand that partnership to others in SLO.
Thanks, Vaughn. I was going to hand it over to Silvano at MECOP, but you know, I know Vaughn's worked with MECOP for many years in Santa Barbara County. So maybe Silvano, and then also talk if there are other people on the call who would like to talk about how to do better outreach and working with Mixtec speakers.
I would certainly say that it's a good move that you're working with MECOP. That's going to be very important for the full scope Medi-Cal. Down in San Diego, where I am, there are several community-based organizations that are focused specifically on getting Indigenous people enrolled in the new Medi-Cal, you know, under the new requirements. And so they're going to health fairs. I work very closely with Vista Community Clinic, and they have these health fairs where they not only take vitals and do some small exams, but they also are helping people fill out their Medi-Cal forms. So, I mean, things like health fairs and working with the community-based organizations, I think, are the best methods to reach and do outreach with that community.
So Silvano, maybe you can jump in because the MECOP is partnering with the County Public Health Department on health navigation. And Silvano's the newly appointed health navigator.
Sí, así es.
That's right. Thank you for the question and for your comment. I am coming out of this survey / investigation, and I have been hired as a navigation coordinator, but currently we have an outreach specialist who is Silvana and Silvestre Gregorio here in MyCop. They do lots of outreach. They table on the streets and they share flyers to let people know that everyone can access Medi-Cal. I think it's great work that they have been doing during January, and from this I can see that lots of people have enrolled and have applied for Medi-Cal. And for those who haven't yet, I can also help them to obtain the forms, and I can help them fill it out. And we all know it really depends on their income. So most people who don't have a stable job, we help them fill out a form. And I also help the majority of people who do not understand Spanish And if people understand but once I meet people who are fluent in Spanish, then they can better access some of the social services sites and resources, and they're able to help them. But yeah, we continue to work on that here in Paso Robles.
Looking around for other questions.
Again, considering that WhatsApp, and I don't know anything about WhatsApp, so I don't know how it works. So maybe you guys can enlighten me here. The group can enlighten me. Is there an existing, so it works in groups. Is there an existing group that we can leverage or use already, or to send out communication if we're doing videos, or we have to disseminate information? Is that how that works, or no?
La aplicación de WhatsApp se puede
The
crear
WhatsApp application, you can create a group. If you're an agency, you can create a business account on WhatsApp and recruit a list of people that you are in touch with, and you can, it's just a way of creating like a broadcast messages, and that way everyone gets the same message. And you can also get in touch with me for more information regarding this and help you set that up.
I might add that as this is a relatively new population or immigration into the county, MECOP is also very new in the county. You know, we're incredibly, well, I'm thrilled that MECOP was able to open an office within the last year. And a lot of that had to do with the survey and some other state funding and COVID funding. And so we're still developing an infrastructure to work directly with the Mixtec speaking community. So, you know, this is, and I have to say, just the survey itself has been a great impetus. It is not only to raise awareness, but to raise activity levels. And I see Yesenia has her hand up.
Hello, thank you. So Yesenia Chavarria chiming in. Right now I'm wearing my Salud Carbajal hat, but I'll take it off and put another hat on. So answering Leo's question. So there is a group that focuses on the North County, and we're looking at, I head that group. It's called 805 La Voz. And if you go onto Facebook, you'll see the page. The page itself doesn't have a lot of traction, but if you go to the private group, it has 1,600 people. And what I like about the group is that we're able to track how many people the posts are reaching. So for example, the earthquake that happened this morning, it has only 8 reactions, but the post reached 950 people. So we're able to track things like that. So part of the work in this whole language justice is we want to bring in the Mixteco language to be able to reach out as well in our group. So we'll be doing more translations, audio translations, because it's my understanding that this language is more an audio language than a writing language. So that, to answer your question, Leo, I think that's also another avenue because we have so many people that are on Facebook.
Yesenia, can you put the link for that in the chat?
Yeah, I can put it on there. And also just a heads up. So if you have resources for the community, you're welcome to post on there. You just have to join the group. We post resources of events. We translate information that is important to the community. One of our big ones was the weather that was, you know, propense to flooding and such like that. We're really monitoring the SLO County Public Health Department to make sure that people know. And this is really a one-stop shop hub for folks. That way people are not having to search social media or anything like that. And then we're also going to go ahead and probably start an Instagram page as well. So it's a fun little place, and it's getting a lot of traction recently because it also focuses on the local issues that are concerning to residents of we focus a lot on North County, but we focus also on all of SLO County.
That's great information, Yesenia. Also, just to add to that, there's a lot of It takes a little bit of homework. You might want to talk to people from MECOP, but oftentimes Mexican Indigenous communities will organize Facebook pages or Instagram pages based on a band that they're in or a dance that they do. So there's a lot of traditional dance like Baile de los Rubios. And I've found that on Instagram and Facebook, it's a really great way to communicate with the larger community is through these, identifying, okay, what bands, what hometowns are in San Luis Obispo, and then are there any bands? Are there any dance groups? Because those folks are really connected deep into the community.
And that's a great point. And thank you so much for bringing that up, because one of our, now switching hats to another group, Mujeres de Acción. Mujeres de Acción has had a lot of traction with events. Right now we're planning our Dia del Niño, which will be held in Paso Robles Friday, April 26th from 4 to 8 p.m. We are still working on the application with the City of Paso. The City of Paso just updated their extensive application, which makes the process fun. But we have the date locked in. And so I think that's another great component for our cultural events that we do, El Dia del Niño and Mexican Independence Day in Paso Robles as well. So right now it's had a huge presence of the residents of Michoacan. But once again, leveraging these big events to make sure that we're being inclusive of not just one culture, but multiple diversity, even for folks from Mexico. So thank you for that.
More questions or comments? Demetria.
Yeah, can you all hear me? Yeah, just some comment, some feedback on what Bonnie mentioned about those groups on social media. There are some communities that have created some groups like that, and it does vary on who they can reach, but I believe they are pretty tied deeply into the communities that are in California. Just for example, let's say Santa Maria, they have a comité for the city of San Juan Piña. And I believe they've now integrated with another smaller village that's a neighboring village in Mexico next to San Juan Piña, in Huitlahuaca, Oaxaca. So if you look them up, you'll find them on Facebook, San Juan Piña. And that comité is usually like the community members from that area, that region in Mexico, for the families that are here in the States. And with that, it's more of the connecting with families, of educating them of what's going on in their current home village and how they can help out here as well too. And a lot of it is helping out with families who are either losing family members like death, and either having them transported back to Mexico, or having family members from Mexico transported to the States if they don't have any family members to bury them. Also, there's some like contributions where they can help aid in funeral costs, and it's like donation. They tend to donate to the family members. They'll collect it, donate it, and use that for funeral expenses. So that's just some feedback for something that's close by here in Santa Maria. I'm not sure if there is a community like that in Paso Robles or in SLO County, but just wanted to let you know.
I'm trying out Yesenia's Facebook pages.
Sí, está bien.
Easily diverted. More questions or comments?
I have another question. Actually,
Sure,
I have two, but don't want to monopolize though. The first question is, you mentioned that on your resource website, you'll have a bubble over the text, and if you click on, it'll be audio. Will that audio be in Spanish, or if it's in one of the indigenous languages, what variant have you chosen, or is it multiple variants?
It's going to be, well, we're going to do it in both Spanish and English, so it'll be a bilingual written website. And I think Silvano's more involved, but the majority speak Mixteco de Guerrero. But I think it was, I'm looking for Silvano's picture here, so he can jump in and hopefully respond to that.
Así es. Aquí, en el norte del
That's
condado.
right. Here in North County, the majority of folks indicated that they speak Mixtec from Guerrero, while the majority of folks from Nepomo, who are from San Martin Peras, from Oaxaca, they speak a different variant. So most folks we interviewed here in northern region are from Guerrero. So Dr. Mario Espinosa asked us to create audios in Mixtec. So I recorded those and myself and the other colleagues who did the interviews did the recordings. So if you get to hear those audios, you'll hear myself, my colleagues speaking in those variants. So if we do find out there are other communities from Oaxaca that have a very different variant, then we might make changes or upload an additional variant.
You got a second question, Vaughn?
Yes, and I promise it'll be my last.
No. We love SenCal being involved in our county.
I have so many questions. But you know, I think earlier on one of your slides, there was a rental assistance that percolated up as a need. And I'm wondering if you could speak more about that housing insecurity or risk of homelessness. And are you seeing that among specific demographics?
Well, the housing overall, was incredibly impacted in overcrowding. So it was, would be inadequate according to CDC guidelines. It's unhealthy, in literature, it's unhealthy. Among a community, a very close-knit community, the risk of quote, homelessness is not, in the sense of you get kicked out and there's nowhere to go, because there's always somewhere to go, which just creates even more overcrowding. So I don't know that we could look in whether it was more in North County or in South County. It's hard to say. Now, one thing I should point out is, 80% or so of our interviewees were in North County, and nearly all of them were from Guerrero. It's a different population or different community group in the South County in Nepomo, where most of them or almost all of them were from Oaxaca. And I think probably more closely connected to the Santa Maria and Santa Barbara County Mixtec speaking community. While we have some data on differences between the two geographies, I don't know that we asked about housing per se. Okay, and Chelsea, I see you have your hand up.
Yeah, thanks. I absolutely am enthralled with the idea of having the bubbles pop up on the website. And I was just wondering if someone from the study could point me in the direction of who you're working with to get that done. I would love to have that on our website in the future.
I think it's Mario and Alex.
Thanks.
It's nice to have younger investigators on this who are much more computer savvy than Bonnie and myself.
También quería agregar, Chelsea, que
Chelsea, I also wanted to add that Mario knows how to upload audios in Mixtec on the website, but we were the folks chosen to record the audio and then send it over to Mario, and so he was the one to work on that and upload it. So what we do, or what myself and my peers did to make sure that the audio in Mixtec, so like right now, since like how we have interpreters from Spanish to English, in order to do something akin to that for accuracy, we had to research terms that exist in Spanish that we had to find equivalents for in Mixtec. So we did have to do that research and explain it out in Mixtec. So the Spanish message isn't going to be the same as in Mixtec, but that's the work of the interpreters that they have to do.
Can I talk a little bit about the question you had about the housing insecurity? Just from our practical experience with home visitations with our clients. So most of our families have a high level of housing insecurity. As Joel indicated, it's impacted or overcrowded. They are typically living several families, sometimes anywhere from 10 individuals in a home, could be a 3-bedroom home. And if they do get a place, some of it is subpar. It's not landlord or rental, I guess, security that they have. It's typically very high cost. Sometimes they're living in trailers. So those are the types of families we see. And then if they need to find a place and they've been displaced, it's very difficult for them to rent something because they may not have all of the credit scores, the lease agreements, all of those pieces that it takes for anyone to rent a home in the community.
Not to mention the cost of housing.
I'm going to chime in again now wearing my Congressman Silvio Carbajal hat. The nice thing about wearing multiple hats is that you have an understanding of how things work and the limitations of where things work. So obviously with housing, and we all know this, I know this is a safe space. We all know we're dealing with folks that are undocumented, have no credit score, may not even be tracking how much money they're making. So when the avenues of applying for housing, it has to be very non-traditional. That puts them in vulnerable situations. I participated in the point in time counts in San Miguel and came across folks that needed housing but didn't really fall under the homeless category. So then now with the federal government, obviously any sort of that federal government aid is not really going to prioritize, unfortunately, this demographic. I think one of the cool things that we could really push for locally is really looking at farmers that, you know, whether it's looking at the demographic for our Mixteco community, grape growers, really looking if there's farm housing, which I know there's a bill and other projects, but I think on a local level, we got to bring our farmers in to really push for that housing, because I don't see housing really happening for this demographic of folks. Legislation in Congress as it stands is a circus, and there's just too much going on. So if there's a way we can get creative of having those conversations, I think that would address the housing issue for our Mixteco community.
Thank you, Yesenia. We have a few more minutes, but in the interlude, you've heard a lot about our team that was able to put this together. But there's a whole back team at the Public Health Department who I really want to thank. You know, Joyce and I have probably been on the phone several times a week for the last 2 years about getting this done. But I also want to, you know, thank Liz and Cindy and Demetrio for really, you know, it's hard to get a public project moving. And it was a creative use of COVID CDC funding that we could put to health equity within San Luis Obispo. And I don't think Abby's on the call, but sort of the guru in all this, who, you know, went with a fine-tooth comb through the manual trying to figure out how to make this happen, was Abby Lassen, a longtime colleague of mine. So I just wanted to call out everyone on the public health staff, and if I left anyone out, I apologize. So are there questions or final comments here? I can hand it back to Leo or Joyce and see if there's anything you want to do to wrap up. Silvano?
Sí, yo solo quiero agregar un poco sobre
Yes, Joel, I just want to add a little bit to the access to housing topic. This is an issue that has long been faced and this community will continue to face. And yes, we need to continue to work to ensure that our community has access to fair and just housing, primarily farm workers and mixed farm workers, because a lot of folks are afraid to organize or strike or do the things that are needed to push for just housing. As was mentioned previously, many folks are undocumented. So folks really do live in fear to advocate for themselves on this end. And MyCop has been working for quite a few years to empower the community and teach them about their rights as farm workers, their rights in regards to health and education and housing. But as we continue growing here in San Luis Obispo, we hope to build more opportunity to support our community on this specific topic. In the meantime, I do ask for folks who are working with different agencies here, or providing specific services, to be patient with folks, seeking services when you're asking them for information. Even when folks here are seeking housing, they don't meet the requirements necessary to be able to rent out a place. And so even just they go through that and asking for other kinds of services. So I just wanted to mention that. Thank you.
Well, thank you, everyone. As the health equity program manager for the last 2.5 weeks, this is exciting. It excites me to see everyone who came out, participated, for the questions, for the energy. I just remind everyone health equity is a process. It's not an end. It's not an end goal. It's continuing. We'll all learn together. And I hope that you can take something that you learned here today and analyze internally how we can best serve this population. And if you ever need any help, that's what we're here for. Our health equity team, Joyce and Demetrio, are amazing. And I'm still learning, but I'm also available from the community aspect of it. So thank you, Joel, Bonnie, and Silvano, for all the work that you guys put into this. And Joyce, do you have any last minute things?
When I realized I forgot to thank Jen, because she's not on the call. Who probably not quite as often as talking to Joyce, but Jen's been behind the scenes making a lot of this happen as well. Jen Miller.
Takes a village, and it will continue to take a village to do the work and meet the needs of our Mexican Indigenous community members. So we're grateful for the collaboration and for everyone for attending today.
Will the presentation be emailed to all those who are on the email list, or how can we get access?
I will wait for Joel to send the recording, and then I can share it with everyone that was included in the email.
Great, thank you.
Yeah, and I don't think there are any mistakes on these set of slides. And if you found any, let me know before we send it out. I think we finally got it nailed down. All right. Well, thanks, everyone. Have a great afternoon.
Thank you.
Gracias, thank you. Bye, Joe.
Bye-bye.
Bye, Silvano.
Bye.
Shindabi no Silvano.
Shindabi.
I just need to make sure the recording gets saved. Let's see.
I'm just staying on here in case you need me.
Yeah, well, I'm trying to, let me see. So
Also, when you get the recording, also send the PowerPoint, if you don't mind.
yeah, no, that's exactly, that would be better than the recording is going to be way too long.
Yeah.
Okay, let's see, recording. Yeah, there may be nothing to do.
Okay, bye,
here.
guys. Thank you.
Okay, great, thanks.
And we usually meet with interpreter service too.
Okay.
That's
Do you
why
want to
we're
leave it open? I'm afraid if I end it on my side,
Oh,
it'll
okay.
knock
Thank
it
you.
off.
And Javi, are you still here?
Sí, estamos aquí.
Okay.
I am here, but I was just telling Naira, I don't know that we need to debrief because both of you are pretty familiar with how interpretation works.
Okay.
Faith was pretty good, actually. A couple times people got excited, but it's all good.
Awesome.
No, and they were speaking slowly. Yeah.
I know, I appreciate it. It's just Spanish has so many more words, so I'm like
Right,
catching up with one sentence. So that's the tricky part for the Spanish rendition, but I appreciate everyone's effort to slow down. We see you, we appreciate you. But yeah, no, it's been an honor to be a part of this project, sort of directly providing interpretation for all these meetings, but really just wonderful work. I just want to commend you for all this wonderful work you've all done, and I hope it's very fruitful moving forward in reaching these communities. But that's
Well, muchas gracias. Thank you, and thank you, Joel.
Okay, thank you.
We'll
I
be in
think I've got
touch.
the recording saved. Otherwise, we'll do it again. All right. Bye-bye, everyone.